the Affordable Health Care Act was not the right direction to go. Compelling or requiring our people to buy health insurance as a mandate for being a citizen of the United States. Again, not the direction I would have gone in. But the fact is that that was upheld as constitutional. What was struck down as unconstitutional was the other part of the law, which compelled states to basically use their Medicaid portal as a way to bring in more insured lives. So that if you didn't have insurance, you were required to be enrolled in the Medicaid system. Now, Medicaid is a particularized state-federal partnership. It's an insurance plan, but it's an insurance plan for individuals with special needs, elderly citizens who don't have support through Medicare only or the private insurance, so they need augmentation in terms of resources, and poor women and children. It's going to a particularized population. But Medicaid is not designed to take, working people who have healthy lives and are in a good position to control their own health care needs and live a healthy life for themselves and the incentive to do that. We should design a private sector, free market insurance exchange working with a high-risk pool. So I would design a plan working in partnership with the federal government to say, don't force us to use Medicaid. Let us substitute what your plan is, Washington, for this plan, which will achieve the same objectives of what you have. Because we are not compelled to go down this road, I think we are in a position of great leverage with Washington to design a plan, if it meets the objectives of the law, and that's to insure all lives and provide coverage to those who are able to do so, then we should be able to meet that test. That's the approach I would take. And that's a very different approach than my opponent takes. She supports not only Obamacare, but like I said, Medicare. My focus is on private insurance working in partnership with government. Not fewer insurers, more of them. We need to look at the laws we have in the books right now. Everything from community rating to the mandate structure we put in place that has basically driven out insurance carriers from our state. There are only about 2 or 3 insurance carriers that provide most of the insurance coverage in the private sector. But yet there are 50 health insurers that are registered to do business in New Hampshire. But they really can't access the marketplace given all the constraints that we've imposed right here in New Hampshire.